Okay guys, here we have a very important lecture on brachial plexus. Before starting the lecture of brachial plexus, you should aware about some terms that can be used and their concepts will be used in the topic of brachial plex. So here we have a variations of brachial plex. So here we have, so first term is about anterior rami. A rami is equals to a branch, you can say the branch of nerve. So anterior means a ventral branch. So here we have a spinal cord, a cross section of spinal cord. Here we have a ventral root and a dorsal root. The ventral root will give rise to anterior rami, and the dorsal root will give rise to posterior rami, or we can say it ramus. Okay, so anterior root will supply the front of neck and limbs. So the front side of the neck and limb will be supplied by the anterior rami, and it will give rise to brachial plex. Okay, so the anterior rami will give rise to brachial plex, and it will supplies the upper limb. So all nerves that are supplying the upper limb is originated from brachial plex. Okay, so the posterior rami, or posterior ramus will give rise to sacral plex and lumbar, you can say lumbar plex, and they will supply to posterior aspect of neck and the back. So here we have important terms and about anterior rami and posterior rami. Okay guys, now we will discuss about the brachial plexus. So here we have roots of brachial plex, trunks, divisions, quads and branches. So brachial plex in normally the brachial plex is originated from C5 root to T1, and we have three trunks of brachial plex that are originated from roots. First one is a superior trunk, middle trunk, inferior trunk, and then we have a divisions. We can say it's a ventral divisions and dorsal division. So after the divisions we have quads. So there are three quads that are originated from ventral and dorsal divisions and from trunks and roots. First one is a lateral quad, posterior and medial quad. So here we have a brachial plex. Now we will discuss about the variations of brachial plex. So first one is a prefixed and postfixed. So brachial plex can be prefixed. It means that it can be originate from C4, and the superior most part of the brachial plex can be originate from C4, and it will ends on inferior most root C8. You can say it, the prefix brachial plex have root value of C4 to C8, and it is important MCQ point. Now we have the post-fixed value of brachial plex. The brachial plex can be post-fixed, mean it can originate from C6 and it will lead to T2. That are the two variations in the brachial plex, and we will discuss about other variations too. So if we talk about the post-fixed brachial plex, then it will originate from C6 and it will end at T2. That is a root value of post-fixed brachial plex. The superior most root value is C6 and inferior most root value is T2. Okay, now we will discuss about the variations of brachial plex. The first variation is in normally the superior and the superior and middle trunk will give rise to the lateral cord. As you can see here, that is originating that is giving rise to the lateral cord. Okay, and in varied version of the brachial plexus, the lateral cord receive fiber from inferior. In what will happen in a varied version of brachial plexus, the inferior trunk will give rise to the lateral cord. It will happen in a varied version, and normally it is originated by a superior and middle trunk. Okay, so next one is a normal inferior trunk give rise to the medial cord. As you can see in this pic, the inferior trunk is give rising to the medial cord. But in a varied version of brachial plexus, the medial cord receive fiber from superior trunk. As you can see here, that is a normal brachial plexus, but in a variation of brachial plexus version, the superior trunk will supply to the medial cord of the brachial plexus. So there are some kinds of variations due to you can say it abnormalities or something like that. So here we have our today's topic. I hope you have enjoyed it. Stay tuned with us for further lectures. Subscribe my channel and press the bell icon.